G'day and welcome to the pot diving safety module, which has been designed to raise your awareness of the hazards and risks associated with diving on snagged lobster pots. On occasion, a lobster pot or pot rope will become snagged on the seabed and cannot be hauled on board. Subsequently, it may be necessary for one of the crew to dive underwater using scuba or hooker gear in an attempt to free the pot or pot rope. Diving on a snagged lobster pot is a high-risk activity that requires careful planning and a risk assessment to safely complete. Only scuba divers that are certified and medically fit should attempt this task. Under no circumstances should anyone free dive on a snagged pot. Diving on lobster pots meets the definition of occupational diving according to the Australian Diver Accreditation Scheme, and therefore only divers that have been trained and certified to at least AS 2815 standard Part 1 scuba diving to 30 metres should dive to retrieve a snagged lobster pot. A recreational scuba diving certification is not adequate for this task, and a skipper that allows such a diver to release snagged pots risks prosecution under workplace health and safety law, particularly if the diver is injured or worse. Like all workplace activities on board, diving on lobster pots should be covered in the Boat Safety Management System or SMS, including a description of standard operating procedures for pot retrieval, associated risk assessment, use of appropriate diving gear, appropriate training and gear maintenance schedule, and relevant emergency procedures. It should also be pointed out that with one or more divers in the water, the minimum crew manning level, as described in the boat's SMS, may be compromised. Manning levels apply to crew on board the boat, not in the water, and for this reason some skippers do not allow diving on snagged pots. As an alternative, a skipper may occasionally make a dedicated trip with suitably qualified divers on board to retrieve one or more snagged pots. On the basis that a suitably trained and certified diver is on board, the first step is for the diver and the skipper to conduct a risk assessment and evaluate if the conditions are suitable for diving. The diver and the skipper must develop a dive plan and discuss the depth and conditions of the dive, including influence of sea, tide or current, the proposed dive duration, options to release the snagged pot, any potential or perceived hazards and appropriate responses, and the need and duration of a decompression stop during ascent from the seabed. There must also be an agreed diver rescue plan in place, including the use of a second diver and emergency response, and both the diver and skipper must be satisfied with this plan. That feels uncomfortable or hesitant about the prospect of diving on the pot for any reason should not be forced to dive. A diver should also be replaced by another trained and certified diver if they feel fatigued, injured in any way, has a cold or flu, is under the influence of alcohol or drugs, or is just feeling unwell. The diver should then prepare to put on the dive equipment with assistance of the skipper or other crew if necessary. This equipment must be regularly maintained and tested in accordance with details described in the SMS. A second diver should prepare to dive and must be ready to lend assistance to the first diver if necessary. Both divers should wear a wetsuit and gloves to protect the body and hands from injury as a result of contact with the reef. The dive flag should be displayed, warning other vessels of diving activity nearby. The diver should enter the water after the diver and the skipper have agreed it is safe to do so, and when the second diver is also ready. If the diver then feels uncomfortable about anything, he or she should call the dive off. The skipper should do likewise. The skipper must record the time and depth of the dive, as well as that for any follow-up dives. The diver should descend whilst holding onto the snagged pot rope for guidance and to pull himself or herself down. When the diver submerges, the skipper, second diver and other crew must keep an eye on the location of the diver's air bubbles. The skipper should warn approaching vessels to stay clear using the two-way radio or by any other means. The second diver should already be in the water and ready to lend assistance to the first diver if necessary. The second diver must be wearing their dive gear and ready to descend at the first sign of trouble. In limited visibility, the only visual cue of trouble may be if the first diver's bubbles stop, slow dramatically, or flow freely or constantly. Once the snagged pot has been released, the diver should use the pot rope for assistance to ascend to the surface, making appropriate safety decompression stops during the ascent. At a minimum, a decompression safety stop of around 3 minutes at 5 metres should always be applied. The duration of a dive should ideally not exceed the so-called no decompression limit, which increases risk and requires additional decompression time during ascent. Recognised dive decompression tables should always be consulted to identify a need and duration of decompression stops. Steps should then be taken to assist the diver to leave the water. If a portable ladder is available, it should be secured to the side of the vessel. A lifting sling may be necessary to help retrieve a diver that is injured, fatigued, or otherwise unable to climb the ladder. The second diver may need to render assistance. Ideally, the boat should be in neutral gear during this manoeuvre, although when the diver is at depth, some propulsion may be required to keep the vessel near the diver in a strong tide or wind. Once the divers are on board, the pot rope can be hauled and the pot retrieved. Excellent! You have now completed the pot diving safety module. Now let's review the material that we covered.